Marnie, I spoke with that Texas trauma surgeon this afternoon, and she's really been using her social media platform to offer insight behind the scenes as to what's going on with COVID patients and COVID units across the country. And when it comes to those COVID patients, even if you've been given the all clear, your lungs may be telling a different story. This story started with a tweet.
I don't know who needs to hear this, but post-COVID lungs look worse than any type of terrible smoker's lungs we have ever seen. And they collapse and they clot off, and the shortness of breath lingers on and on and on.
It quickly grabbed the attention of thousands, including us. The message coming from Dr. Brittany Bankhead Kendall, a trauma surgeon in Lubbock, Texas, who has spent the last 10 months on the COVID front lines.
I just thought it was really pertinent that people understand that this isn't a bimodal disease. It's not you have it and then it's gone. It's something that is lingering.
Just for reference, this is what a pair of healthy lungs looks like. The X-ray showing 2 clean cavities. The black spaces are air, no congestion. Here they are on a CT scan. For those who smoke, here's a visual of what's typically happening inside their chest. Dr. Bankhead Kendall pointing out the scarring left over from a lifetime of smoking.
Whenever I pull up that smoker's lung, kind of immediately what I'm seeing is maybe a little bit of what we'd call congestion. So heart getting a little bit fatigued, it's not pumping things through as well.
For those of us who aren't looking at this with a trained eye, then you go over to the COVID lungs.
Yeah.
And what's your takeaway from those images?
On these chest x-rays where you see a dense, cobwebby looking appearance, that's what it is. It's old residual COVID, or it's problems with your lungs that happened because we were trying to treat you and keep you alive, and it just didn't get better.
Here they are, side by side. X-rays like these now lighting up frequently for her at the hospital. Sometimes the only common denominator shared among the patients being that they had the virus in the first place. Severe chest scans coming from people who didn't even have a hospital stay.
Not everyone who is doing really, really poorly has a terrible chest x-ray, and not everyone who's doing really, really well has a good-looking chest x-ray.
And because it hasn't even been a year since the pandemic's onset, it's too early for evidence-based studies to show the impact of COVID-19 on different organs. However, Dr. Bankhead Kendall says she has now seen enough sets of post-COVID lungs to label the damage a trend.
And it's not only a trend, it is the norm. It's the norm that when you're sitting there and going over the list of patients for the day and you're scrolling through CT scans and you're pulling up x-rays, you can immediately tell, yeah, this person's had COVID, this person has not had COVID.
And Dr. Bankhead Kendall also telling me another alarming piece to this puzzle is that it is too early to be able to tell whether these COVID lungs with all this damage, if that will repair itself or if that scarring is permanent. And she also did offer up that on Friday she gets her second round of the COVID vaccine, and she offers or encourages, I should say, other Americans to do the same, saying that any long-term side effects that comes with this vaccine will not be worse than what she is seeing right now in the hospital. Reporting live in Dallas tonight, Marky Martin, News Nation.